I studied the development of optical fibre technology and I learned that using this technology it was possible to lead to improved health outcomes. So I've been working over the last 9 years in UWA towards developing this technology. The device that we're developing will allow surgeons to detect cancer during surgery, removing the need to go back to remove tumour that they've missed in the first surgery. The technology that we're developing can really improve the outcomes for breast cancer patients by significantly reducing the amount of surgeries that patients need to undergo. So over the last 4 or 5 years we've been working really closely with surgeons in getting them to demonstrate how our technology can improve things. But that interaction with surgeons and also pathologists, it's really allowed us to understand their needs and their requirements more clearly. It's really important not only that 1 or 2 surgeons that you collaborate with locally use it, it's important that it's used worldwide. So we're really trying to make collaborations, particularly with surgeons globally. At the moment, surgeons only know if they've done a good job days after the surgery because they don't have tools during surgery that can accurately detect tumour. So often surgeons are using their fingers or just their eyesight during surgeries. With this technology we place a specimen of breast tissue on this stage here and we then perform high resolution imaging and we get these images which are demonstrated on the screen here. So this is an example of a case where we collected the specimen from the surgeon directly after the surgery, and the surgeon told us that there was a region here that felt suspicious, but then in our images we can see that region which she felt was a bit suspicious actually corresponded to a dense region of tumour. We can demonstrate that in this case, if the surgeon had this technology available during the surgery, she would have been more accurately able to remove all of the tumour the first time around. At the moment, we're demonstrating through clinical studies the utility of this system using this benchtop, quite bulky system. But in parallel with that, we're developing back in the lab more handheld, compact imaging devices which could be used in the surgeon's hand during the surgery. So staging the technical development in such a way that we've got a more basic system at the kind of clinical front, if you like, whilst in parallel developing new technologies is, I think, a strategy that's been very fruitful for us up until now. If we can make a difference in even one person's life, I think it'll make it all worthwhile. So I think that's fundamentally where I take inspiration from.